Swayam Prabha. Digital India. Educated India.
India has a population of 1.4 billion, out of which 39 billion people fall below poverty line due to health related expenses. When we particularly look at the medical device sector, we see that 80% of the products in the medical device and diagnostic sector are imported, which can be bought only by 20% of our population, meaning thereby 80% of our Indian population cannot buy such medical devices as they are very costly. Therefore, there is a dire need to develop Make in India medical devices by using frugal approach or Gandhian approach to medtech or healthcare innovation. This will help us to make the healthcare achieve the mantra of 3 A's: affordable, accessible and available to our country. When we think about monetizing research for societal benefit in the talk today, I would like to urge the young innovators and students to focus on the societal impact first. Your focus should be on solving pressing unmet needs of the country in a frugal way by developing products with huge societal impact. Frugal yet quality products for the masses, and if you develop such quality products for the masses, money will be a byproduct. Your growth is inevitable. The India's growth story can be yours. However, there is a secret recipe to developing a commercializable product which we are going to discuss today. So, in my presentation which we are going to discuss today, we are going to discuss monetizing research for societal impact, wherein we will be focusing more on developing. In the first part of the talk, we will be focusing on how to develop a monetizable IP or commercializable technology, and then I will be telling you about how to transfer that technology, how to monetize that research for societal impact with the core of societal impact in mind. So, a typical journey of technology development and translation has 3 phases. You all are aware. It has 3 I's: identify, invent and implement. Generally, a technology development starts with the funding opportunity. Then you have what you look at the whatever is available, you try to do unmet need identification, the problem identification. Then you look at what are the existing solutions which are already available in the market. You look at the solution space, and then you identify an idea, that idea which comes into your mind in the identify phase. From idea to prototype or invent phase, you try to solve that problem by developing some kind of prototypes or doability assessment. Then you do technology demonstration and validation. For commercializing a technology, you definitely need to have some kind of regulatory approvals in place, which all happens in the invent phase, and then you go into the implement phase of commercial production and product in use. What happens? This is a typical journey of technology development and translation, but we have seen that it does not happen particularly in the academic institutes. Why? Because academic institutes have strength to develop technology till proof of concept, they do doability assessment, they reach early stage of invention phase, then comes lot of valleys of death. And what we see is a bucket filled with proof of concept lying down at the academic institutes, needing some kind of hand holding support so that they can surpass the valleys of death and we can develop products for societal impact. In my presentation, I am going to unveil the journey of technology development and translation, wherein I will be telling you some important things which should be kept in mind while developing the technology so that it becomes a commercializable technology lead. And the other part of the presentation will cover on the ways to monetize research for societal impact. For ease of understanding by the students, the listeners here to us, I have tried to put in one case study which I will be running it throughout my presentation for having better understanding by the students. So, starting with the journey of technology development and translation, it starts with the team building, interinstitutional collaboration. Generally medical and engineering institute, multiple institutes come together, they think that yes, this is something which we need to solve together. They may be put in some proposal which is supported by the government, and then we have a multidisciplinary team of maybe doctors, engineers coming together to solve that problem. So, this is the phase of team building. In the first phase of team building, we start on a very good note. We have collaborators in place, we have inventors engagement, but we really need to keep in mind at this point in time, if we are thinking about developing a commercializable technology, we should have a clarity on IP ownership rights, who is going to own the IP. We should have clear understanding on the terms of engagement of inventors, who has the licensing rights, the inventorship clarity also needs to be put in place, because we all will understand, if we have a strong base, we can build a very good building around that. So, that base needs to be very clearly defined when you have to develop a commercializable technology. So, I will give you an example of NeoBreathe. NeoBreathe is a neonatal resuscitation device which was developed by a startup company, Windmill Health Technologies. This technology was developed through this startup company, and it was developed by a collaboration between Medical and Engineering Institute, AIIMS and IIT Delhi. They came together, Department of Biotechnology, Government of India agreed to support this initiative, and then all the three institutes along with the government thought that one party should own the IP, so that technology can be easily licensed to the startup company. So, with the consensus of the three parties, IP was owned by DBT, Government of India, because it is a neutral organization with a commitment to exclusively license the IP to the startup company. Even they had assignment rights put in place in the fellowship agreement, so that when the right time comes, the technology can even be, IP can even be assigned to the startup company. So, you can see in this example that when the teams plan to develop an innovative technology called NeoBreath, the team came together, the innovators, the collaborators all came together, and they brought in lot of clarity on IP ownership, licensing rights, IP inventorship. The way I mentioned that you should have the right base in place for the building to go in the right direction. Coming to the next phase of technology development and translation, which we called as identify phase. This is a very, very important and crucial phase, because the unmet need identification becomes very important. If you have identified the right unmet need, then and you solve that problem with huge societal impact, then it automatically finds the value, it automatically finds the market. So, this typically should happen through clinical immersion in hospitals. Unmet need identification is a very thorough process, it is a very methodical process. It should be done in the hospitals by talking to the caregivers, healthcare providers, and not only that, it should also be backed with IP due diligence and market due diligence, so that at the end of the day you should have a potential for file an IP for that invention, and you should also find a good market to commercialize that IP. So, what this team saw, they identified that the problem of newborn deaths or birth asphyxia due to birth asphyxia is a preventable problem. They saw that 5 out of 100 newborns they have the problem of birth asphyxia, they die due to birth asphyxia, and it is a huge problem, but it is a preventable problem. So, it was a problem which is huge, and these people, they did clinical immersion and AIIMS and associated primary healthcare centers and CHCs. So, then they looked at the solution space and saw that why this is a very simple problem. We have ambu bags which you can use in the hand, put it on the face of the child, the newborn, make a seal and then push it so that the child can be resuscitated. Why such a simple device already available in the market is not able to solve this problem? So, they looked at the solution space and tried to understand what is the problem. They saw that there is lot of leakage which happens when they use the ambu bag or the existing standard of care. This situation, which is a crisis situation, needs multitasking. You also need to put that mask on the mouth of the child, and at the same time you also need other hand to create a seal on the face of the baby. At this time, since in our healthcare settings you do not have many healthcare providers to look at one patient, because there are huge lot of patients, you also need some other people to help with the looking at the heartbeat of the child. So, multitasking is required at this point in time, limited time is there, we have limited skill set available, and there is a problem of leakage. That is why the ambu bag related resuscitation is not happening in a very efficient way, the way it should happen. So, this is what the team saw. So then they looked at two kind of products which are available and are being used by the people, the healthcare providers in the hospitals. One is the technology which is relatively low end, it requires less skill set, which they called as the ambu bag. On the other side of the spectrum is a T piece, which is a high end technology but very costly. It is very efficient but it is very costly. So team was very clear, they saw a huge gap in the technology landscape and they were very clear that they need to develop a product which is frugal, cost effective as well as very efficient. And they realized the need that if one hand can be made free to do other tasks which are required at the time of resuscitation, then it can really solve the problem. With this thoughts in mind, typically looking at the market space, the existing competitors, they developed the solution Neo Breath, which is easy to use advanced manual resuscitator. This device is a foot pedal operated device. So if you operate this device through foot, you have one hand free. So this increased the efficiency of usage of this product. This product is novel because the problems that it could solve was that it could do a better sealing with both hands, and it was efficient multitasking tool. One hand was free, one could also use, the caregivers could use one hand to look at the heartbeat of the child, and then it was really a good thing to do. This product really received lot of acceptability from the healthcare providers. So when they thought of this idea, the innovation was there in their mind, the key features of the invention were very clear in their mind. These team tied up with an IP firm which helped them to do patentability assessment. Here I would like to warn or bring into the notice of the young budding entrepreneurs that as and when we come with a new innovation, we are very excited and we think that we should definitely publish, or maybe we should put it on our website, or maybe we can go and present that our work in some conference. But here I would like to warn or maybe bring a point of caution to our innovators that what has been seen from IP perspective, that innovators own publication is the most often kills their own novelty, or it becomes their prior art. Because for filing a patent, we have three essential pillars of patentability. The invention should be novel, it should be non-obvious to a person skilled in the art, it should have industrial application. The novelty aspect of the invention is killed if you do publication. So I am not saying that you do not publish, I am just urging the innovators, the young innovators, my friends, that you should first patent your invention and then publish. The team did a very detailed market evaluation looking at the essential key technical aspects of the invention along with the cost due diligence on what should be the right cost of the product so that it becomes market acceptable. So as I emphasized that during the technology development pathway invent phase, you must do a thorough unmet need analysis by talking to the healthcare providers, doing a clinical immersion. You should also do IP and market due diligence. This is what this team did. Coming to the next phase of the technology development cycle, your technology is ready, you had some idea, then it went into a prototype stage. Now it is the time that your invention is ready. Just not one patent will help you. You really need to develop a strategic IP portfolio around your patent. I will give you around your invention, I will give you an example of Neo Breath again. You can see from this example that this team developed a strategic IP portfolio around their invention. When we think about IP, we only know about patents. It is not only patents. The IP includes patents, trademark, industrial design, copyright and geographical indication. These are the different main forms of intellectual property. So what this team did, they not only filed patent application in India, they filed a PCT application which gave them a date, international date for protecting their IP. Then they went in and filed further applications in countries like Africa and other emerging countries, wherein they thought that this technology will have an application. The name of this product Neo Breath, they protected through by filing a trademark application. External aesthetic features of the device, which are very important. Why we like an iPhone is because it has very good external aesthetic features. So external aesthetic features can also be protected by filing a design application, and this is what this smart team did. They filed an industrial design application for this invention. They also filed a copyright for the leaflet which is there within the product, which tells us on how to use the product is something which we can protect through copyright, and then some part of the invention they kept with them as trade secret, which was their know-how. So, this is a very good example of how you can strengthen your IP portfolio. We all know as innovators, we are always very proud of our invention and we feel that it is the best thing which can ever happen in the world. But the true proof of the workability of invention happens when you validate your technology, not only in-house, but by an independent third party. This is what this team did. Since they were collaborating with AIIMS, they worked with medical institutes and hospitals and did technology validation to see that how the technology works in the healthcare settings. And to their surprise, very interesting findings came out. The leakage from their device as compared to ambu bag. Generally, at this state of time, you should compare your device with standard of care, which was ambu bag in the current case. So, this team compared their device with ambu bag and they could come out with the conclusion that the leakage halved when they used their product as compared to the ambu bag, which is standard of care. The ventilation significantly improved in the children, neonates, the newborn children, and there was a significant recovery, better recovery, which was seen in the children when they used this NeoBreath product as compared to ambu bag. So, this was a very interesting finding which came out and which validated their product. Then looking at the regulatory strategy, they filed their application for getting regulatory approvals from DCGI, Government of India, and as part of the international strategy, they also try to look at the CE route to get a CE approval on their device, which they got. For they use the ISO 13485 systems for developing their product, which is very much required as per the requirements of the medical device rules 2017. And since their primary market was Government of India purchase, the public procurement was their main market, they registered their product in GEM portal. It is very well available in GEM portal for purchase. These are some of the good publications. This is also an important strategy. When you develop some product, your data is generated through validation of your technology, you must publish. Why? Because if some very good journal accepts your publication, this brings lot of credibility in your product. And this is what, when you approach the central and state government, they will also try to look at some kind of good publications, and this is what this team did. Now, coming to the other aspect of the technology development pathway, now you have a monetizable research IP ready, you have a commercializable IP ready, you have a product, you have gone through the IP pathway, you have gone through the market due diligence you have done the validation of your technology. So, now it is the time you should think about monetizing research for societal impact, having societal impact at the core of your technology development. When it comes to monetization, there are various ways by which you can monetize IP, but before that I would like to emphasize and try to bring clarity on what exactly is monetization. Monetization is basically deriving monetary value from your IP development. So, you have developed a technology, it has reached a stage wherein whatever best this startup could do has done. So, what about market reach out? World is big. How do you try to go to the markets which are huge, the global market? We can develop technologies locally, but they should have a global appeal. That should be the mindset in today's world when we know that the world is flat. So, these are different ways by virtue of which you can monetize IP. For a startup entrepreneur, you can go and talk to your friends and family and get some part of the money just to start your venture. You also have government investments in place, lot of funding opportunities are there by the Government of India. All government ministries are working hand in hand to enable Make in India for the healthcare sector. And then you also have some private investors like angel investors, VCs. So, these are broadly, if you have to monetize IP, you first of all need to get funding from these sources, develop technology and then try to transfer your technology. So, what is technology transfer particularly? There are different types of technology transfers. We only understand that technology transfer is transferring a technology from academia to industry, but it is just one form of technology transfer, it is vertical technology transfer. But there are various ways and means by which we do technology transfer in our day-to-day operations. For example, we have to develop some kind of a product. For example, ICMR developed co-vaccine, which everybody knows is a highly socially impactful invention that we did. ICMR could not have done it alone. So, we partnered with Bharat Biotech. So, it is a public private partnership that we did for developing a product. We can also have private partnership, university private partnership. So, these are different kind of technology transfers, but the most important way we transfer technology is from academia to industry, which is what I am going to focus in today's talk. So, tech transfer, what and whys of tech transfer is what we will begin with. Why do you think we should transfer a technology? We know that the technology is typically developed in a research institute. Research institute have lot of strengths. They have excellence in doing R&D, like IITs or the school students, they know how to do research. So, they have their own strengths. They can do lot of innovation, they can do R&D, they can develop technology till proof of concept. But industry has complementary strengths, because they have established marketing strengths, they know how to do regulatory strategy, they know how to develop CGMP compliant products. So, industry and academia, they have complementary strengths. Therefore, there is a need to transfer technology from academia to industry, so that these complementary strengths can be leveraged. And how technology transfer is done? It is done by virtue of signing a license agreement between academia and industry, wherein academia, whatever they have developed, say for example, in the case of NeoBreath, they have developed a product, but they could do some kind of a marketing and reach out of the product in India. But what about global transfers or global reach out? So, that is how they thought that they should transfer their technology to industry. Coming back to the case of NeoBreath, this company thought that being a startup company, a small company, they will not be able to capture the business which this product can capture. Therefore, they transferred their technology to an established player which had already established marketing strengths and linkages within African countries. So, now this product is being sold all over in India, mostly all over in India, and lot of areas in Africa. So, India and Africa are the places wherein they have significant market strengths, and they have been able to make the product available in India and Africa. That is the strength of technology transfer. How do you go about technology transfer is another interesting story. Technology transfer is a very methodical process. It is not just transferring your technology to the other party, it involves a lot of steps. First of all, you need to do preliminary screening and evaluation, followed by evaluation and pricing, because if you have to sell your product to some other party, you need to be very sure on what is the valuation of your technology. There are different ways you can do valuation of your technology. There are various internationally accepted methods of doing valuation of your technology. We have cost approach, we have discounted cash flow methods. So, those methods have to be dwelled upon to do technology valuation and pricing to arrive at a price point in which you would like to transfer your technology to a company. Then some company will not come to you. You need to do lot of marketing efforts, so that people know that you have this technology and interesting parties can come to you. So, that is the next step. You need to do marketing and identification of the potential licensees. Then you need to negotiate and transfer your technology, and after transferring your technology, the job is not over. You need to do lot of post transfer monitoring to see whether the technology is reaching the masses, what is the revenue which is being generated through transfer of your technology, how much revenue should come back to your system. So, that kind of post transfer monitoring is also very essential component of technology transfer. In the interest of time, I will not go into the details of how you do technology transfer, because I think that will need another session in itself. But the take home message that I would like to give to the students and the college faculty listening to this is that you would appreciate that in the entire journey of technology development to translation, there is a very important aspect. There are two aspects which we need to keep in mind. We need to have very good agreements or contracts in place at different stages of technology development and translation. For example, at the stage of team building, you need to have right collaboration agreement in place. You need to have a license agreement in place by virtue of which startup will take the license. At various stages of technology development, you may need to engage a consultant or a service provider. At that point in time, you need to have a consultancy agreement in place, so that the confidential information related to your technology is kept with you only. Then when you are sub-licensing your technology, again you need to have a non-disclosure agreement in place when you can negotiate and discuss with your potential licensee. Material transfer agreement is another agreement which is important when if you have to transfer some material for third party to evaluate your technology. So, so there are different forms of agreements and contracts you must sign from time to time so as to appropriately protect your invention. Strategic collaborations are the key. You should not work in silos, we must work and engage with people, organizations having complementary strengths. Another lesson or message that I would like to draw to your attention is that intellectual property has a very crucial role to play in the entire journey of technology development and translation, and I have taken you through the entire journey, and these are the some important aspects which have to be kept in mind while you develop your commercializable technology lead. So, if we have to really innovate, we should not be working as lions which are not facing each other, medical institutes, engineering institutes, startup and industry not facing each other. All these three partners with complementary strengths have to work hand in hand, tandem, so that we can develop Make in India technologies in the healthcare sector for large societal impact. I would like to end my presentation with a famous quote by Professor APJ Abdul Kalam. Dream is not that you see in sleep. Dream is something that does not let you sleep, and you have to dream before your dreams come true. I would like to urge all the young students and innovators in the schools and engineering institutes to dream and dream big, to solve big problems of the country for societal impact. Thank you and Jai Hind.